Hello everyone, welcome to sqadia.com, and in our first section of the lecture Implantation and Early Pregnancy, we will talk about ovulation, fertilization and implantation, and then we will talk about some hormones of the early pregnancy and signs and symptoms of the early pregnancy. So ovulation is the release of ova from the ovaries. Usually the ovulation takes place on 12th to 14th day of the regular menstrual cycle. So if the regular cycle is of 28 days, the ovulation takes place in the center on the 14th day of the cycle. The second half, ovulation is more consistent with the second half of the menstrual cycle. So once ovulation takes place, and if the fertilization doesn't take place, then exactly 14 days after the ovulation, the menstrual bleeding starts. So it's more consistent with the second half of the cycle. So females who have irregular menstrual cycles, the ovulation is unpredictable when the ovulation is taking place, because the first half is the one which is not very consistent. It's inconsistent. So finding what time ovulation is taking place is very hard in patients who have irregular menstrual cycle. But in case of regular cycles, it's on the 14th day of the cycle. So day 12 to day 14th is the most fertile time of the menstrual cycle, during which ovulation is taking place and fertilization can take place. After ovulation, ova survive for about 48 hours, and fertilization takes place in the ampulla of the fallopian tube. The broad area of the fallopian tube, this is the ampulla. So fertilization takes place in this ampulla. Here if you see fertilized ova. So ova, once released from the ovary, is fertilized in this ampulla of the fallopian tube. Embedding of the zygote. Once the zygote is formed, the embedding takes place in the endometrium of the uterus. This is the endometrial lining of the uterus. So if you see here, after ovulation, then day 0, fertilization takes place. This is the ova, egg, and these are all the sperms coming and attacking the ova. Then one of them, or it penetrate and cause fertilization. If fertilization doesn't take place, then there is beginning of the menstrual bleeding. So after ovulation, this is fertilization on day 0. Then on day 1, embryo, zygote is produced. Then day 2, this is the embryo. Then day 3, embryo. Day 4, this embryo is now called morula. This is the morula. And then on day 5, it's called the blastocyst. And then implantation takes place in the endometrium, and it embed as the blastocyst. Here, fertilization takes place. Then 30 hours after fertilization, it reaches here, and then 45 hours it reaches here, and then morula becomes at the lower end of the fallopian tube, and then it becomes the blastocyst, and it is embedded as the blastocyst, implanted embryo. So this is the step after fertilization of the ovum to the embedding of the fertilized ovum in the endometrium of the uterus. Then menarche is the time when the menstrual cycle begins, and ovulation actually starts at menarche, which is the age around 12 to 14 or 15 years. And then menopause is the time when the cycle ends, then no more ovulation takes place, and this is the time of like after 50 years of age to death. So menarche is the time when ovulation starts. Menopause is the time when ovulation ends. And this is all the stages from ovulation, fertilization, and implantation. Then some hormones of the early pregnancy, some important hormones of the early pregnancy. Most important is the HCG. Here, if you see, very high levels of HCG are present in the first trimester, first 12 months of the pregnancy, very high levels, peak levels of HCG. HCG levels doubles every other day. Every 2 days, it doubles in the first 10 weeks of pregnancy. HCG stands for human chorionic gonadotropin. It's the hormone of the pregnancy produced by the placenta during the pregnancy. So HCG is the hormone of the pregnancy. The other two hormones produced during pregnancy are the estrogen and progesterone. And estrogen and progesterone, as you can see here, their level is low in the beginning and slowly it's increasing, reaching maximum by the time of the delivery. So by 40 weeks, it's the maximum. And HCG is coming to the lowest level at the time of the birth. So these are three main hormones of the pregnancy, out of which HCG is very important, produced by placenta during pregnancy. Its levels are highest in the first trimester, which is the first 3 months of the pregnancy. And level of HCG doubles every other day in the first 10 weeks of pregnancy. Now, some signs and symptoms of early pregnancy. First important is amenorrhea. Amenorrhea means if the cycle or if the menstrual cycle doesn't begin on the expected day, and 2 days pass or 3 days pass, the first thing it comes to the mind, oh, I might be pregnant. The patient thinks about the pregnancy and then they do the home pregnancy test. This is the home pregnancy test. 2 lines are positive, 1 line is negative. If this is 1 line, up to this mark, you dip this stick in the urine, collect the urine in a cup, and then dip the stick in the urine, and then if you see 2 lines it's positive, 1 line is negative. Here 2 lines it's positive. Put the drops of the urine in this, and then if the 2 lines appear, it's the positive. And this home pregnancy test detects HCG in the urine. HCG is the human chorionic gonadotropic hormone. So amenorrhea, no menstrual cycle, is one. Then positive pregnancy test. Morning sickness is very common. Morning sickness, there is nausea, vomiting early in the morning in some patients. It varies from individual to individual. Some females, they say, I have nothing, no morning sickness, don't feel anything. But lot of females, they come and they have really bad morning sickness. There is a lot of vomiting, and sometimes you have to give them infusions to cover that fluid loss. So sometimes this is really bad morning sickness. Frequent urination is also very common in the first trimester when the baby is not or the uterus is not big enough. This frequent urination is mainly due to hormonal changes that increases the blood flow to the kidneys, and that increased blood flow cause frequent urination. But as the baby grow and the uterus get bigger, the pressure on the bladder causes the urination. Then there is sometimes spotting. Breast changes are very common. Breasts are become heavy, full, and then there is some tenderness also. Fatigue is common, very tired females. Usually they don't have any energy. They like to lay in the bed most of the time. So fatigue is also very common. And then mood swings. Depression is very common. Crying spells are very common in the early pregnancy. So in the first section of our lecture topic, implantation and early pregnancy, we talked about ovulation, fertilization, and implantation, and some hormones of the early pregnancy, and signs and symptoms of the early pregnancy. Thank you for watching sqadia.com.